It's a great honour to address this Pontifical conference on the COVID pandemic. I'm sorry I can't be with you in person, but I'm at the climate change conference in Glasgow even as we speak. Now, the COVID-19 pandemic has been an extraordinary event because this is probably the first time in the history of the world where every nation has been presented with the same challenge at precisely the same time. It is a bit like an old examination hall where the students are all lined up at their desks and the invigilator looks at their watch and says, right, it's 9 o'clock, you've got 3 hours, start writing. So we have all been dealing with the same problem in real time. And of course, we've dealt with it in different ways. Borders have been closed, industries have been shut down, loved ones have been separated, countries have been separated from each other, and countries have been separated internally. We've had the extraordinary situation in Australia of state borders being closed for the first time in our history. So it's made fundamental changes to the way we live, to the way we work, and many of those changes will endure. Now, there tends to be, naturally, a reaction to this event of just wanting to go back to normal. Now, we have to ensure that the outcome of the end of the pandemic, which seems to be drawing near, is not just a collective sigh of relief. We've got to learn the lessons of the pandemic and use them as a catalyst for serious reform. You should never, ever waste a crisis. Now, you've only got to look at the experience of the United States to see where a lack of preparedness can have catastrophic consequences. I mean, the richest, most scientifically advanced nation in the world saw COVID-19 spiral out of control in 2020 with tragically high rates of infection and mortality. Even today, the world's largest economy still sits at more than 45 million cases and 730,000 deaths. Now, we can contrast that to the experience in Africa. At the start of the COVID-19 pandemic, many commentators looked to Africa and feared the worst with its dense population and vulnerable health infrastructure. And yet, to date, Africa's experience has not lived up to those fears. The total number of recorded deaths in the entire African continent, for example, is slightly less than those recorded in the United Kingdom alone. And even if underreporting is accounted for, Africa's mortality rate is still lower than in Western Europe. And even though Africa has some of the world's lowest vaccination rates at around 5%, it has been able to contain the pandemic, largely in part due to its previous experience of managing epidemics, including Ebola in 2014-15, and the foundations of community-oriented healthcare systems. Within Africa itself, it's worth noting that South Africa, seemingly more resilient and more developed country compared to others, actually has fared the worst, with the highest mortality rate between May and August 2020, with 33.3 deaths per 100,000 people, far ahead of the next nearest mortality rate at Cape Verde at 17.5 deaths per 100,000 people. Now, what this highlights is that vulnerability and a lack of preparedness are not the same thing. Developed countries, as in the case of the US or the UK, often fared far worse than developing countries because of their lack of health resilience. So we just can't make the same mistakes again. The Reform for Resilience Commission, of which I'm a co-chair with Michelle Williams and Jose Manuel Barroso, has released an interim report based on months of study and research. And one of their key recommendations is the need for stronger global health resilience governance and policy architecture. And I know that's among the issues you're talking about here today. What COVID-19 has made plain is that we really do live in a globalised world with unprecedented connections between countries, regions, people. Obviously, we can communicate instantly, digitally, as I am at the moment, but physically, a pandemic will spread at the speed of a jet aeroplane, meaning no country is safe from the pandemic until every country is safe. And that means we need a multilateral approach. It means collaboration and coordination between countries, regions, public and private sector, and between international bodies such as the World Health Organization, the IMF, the OECD, and the G20. Now take the countries of ASEAN, for example, Association of Southeast Asian Nations. As the report notes, ASEAN countries delivered relief packages independently. Greater coordination, however, could have lowered overall costs and resulted in targeted mitigation within and across those nations. Successful coordination, however, can be found in the case of Taiwan, which through private and public collaboration provided PPE to many countries during the pandemic. The Taiwan Centre for Disease Control also partnered with ASA, E-Enabling Service Business, to create a surveillance system for real-time analyses and reporting. This has proven crucial to monitoring COVID-19 in Taiwan. The surveillance system enables collaboration between multiple health system actors, including medical units, hospitals, and government departments. Stronger global health resilience governance and policy architecture doesn't just happen overnight. We need time for leaders from the separate and regrettably all too often siloed worlds of government, business and health to come together and develop the relevant frameworks and tools so that we're better prepared in the future. Now, as a case study, Australia is a striking example of what can go wrong when you fail to plan. At the beginning of 2021, Australia was largely COVID-free, out of lockdown, and life was pretty much back to normal. But then, when the highly infectious COVID-19 Delta variant emerged in the middle of the year, the truth became all too apparent. Our national government, our federal government, had not purchased enough vaccines. With less than 10% of Australians fully vaccinated in July, the federal government scrambled to find vaccines to inoculate its population. They'd not bought any Moderna, hardly any Pfizer. Pfizer had sought to do a deal with the government in 2020, in June, but were, as we've seen from the correspondence now published, were basically fobbed off. So the only vaccine that we had in any volumes was AstraZeneca, and because of the issues concerning some very rare cases of blood clots in younger people, not only was it not available, made available for people under 60 during the first part of the vaccination program, but also, obviously, there was quite a lot of hesitancy as well. Now, the government's failure to purchase enough vaccines was the biggest failure of public administration in my experience. You don't have to be a public policy genius or an economist to realise that you don't put all your eggs into one basket. Obviously, you want to be making sure that you've got a variety of vaccines from a variety of manufacturers. Anyway, the upshot of this was that Australians, particularly those in New South Wales and Victoria, Sydney and Melbourne, locked down again. So just as the world was opening up, we were closing down ours. And we've only just recently opened up back again in New South Wales, and shortly we'll be doing the same in Victoria. So we've lifted our vaccination rates happily. More than 70% of people over the age of 16 are fully vaccinated, and over 85% have had at least one dose. That, of course, is thanks to the availability of the vaccine. The development of vaccines within 1 year of the onset of the pandemic is absolutely remarkable, and it highlights the critical importance of the global life science sector. The pandemic has been a major spur to global life science innovation. Track and trace technologies, for instance, proved to be vital for containing outbreaks and ensuring isolation measures for those exposed to the virus. Asian countries which had pre-existing sophisticated systems for disease surveillance as a legacy of SARS, proved to be the most adept at containing the pandemic. And indeed, communities where mask wearing was traditional, or something that people traditionally did if they had a cold or a sneeze or something like that as a matter of courtesy, again, they were best able to contain the pandemic because mask wearing was not turned into a political issue, as most bizarrely it was in the United States. I mean, one of the most surreal comments of that surreal presidential election last year was when Joe Biden had to say, wearing a mask is not a political statement. Well, it's amazing to think that anyone would imagine it was, but it certainly was and remains. Now, one of the most urgent priorities has to be to ensure the global distribution of vaccines. We've only got to look to our friends in Southeast Asia, where the vaccine rollout has been uneven and in some places very slow. I've talked about the Australian experience, but take Malaysia. The fully vaccinated rate now stands at more than 70%, and the average number of new infections reported each day has fallen by more than 6,300 in the last 3 weeks. But which is good, excellent news. But for many other Southeast Asian nations, daily cases continue to rise and vaccination rates remain low. If you look at Asia as a whole, about 40% of the population is vaccinated, and that's well below Europe and North America, which sit at more than 50% on average. Recently, the Asian Development Bank lowered its 2021 growth outlook for the region because of the recurring spikes in COVID-19 cases and the resulting lockdowns and economic containment. And with Southeast Asia a critical part of the global manufacturing supply chain, what happens in this part of the world invariably affects the rest of the world. So COVID-19 is here to stay, at least in the foreseeable future. And that means we have to do the work now to make sure that we live safely, freely and productively, even while the virus roams amongst us. Resilience is the key. It's the key to our success now and in the future. So we have to take the time and invest in a world that will be prepared for future pandemics. We cannot respond to the end of this current pandemic with a collective sigh of relief. We've got to learn the lessons, compare the experiences of other countries, choose the best approaches, the best modes of treatment, the best modes of containing the pandemic, make sure vaccine distribution is more efficient, vaccine manufacture is more distributed, and so make sure that when the next pandemic arrives, we can hit it on the head as quickly as possible, so that the world, which has suffered through this pandemic, will be much safer for the ones that inevitably will come in the years ahead. Thank you very much.